Introduction. If upon evaluation of a pregnant female the cervix is dilated to 10 centimeters and/or effaced, thin to about 1 millimeter, and the baby is crowning, an emergency delivery will need to be performed. Indications. Cervix is dilated to 10 centimeters. Cervix is effaced to about 1 millimeter. Presenting part of fetus is crowning. Mother insists she needs to push. There is no time to transport the mother to the labor and delivery area. Face, foot or feet, hand or arm, and breech presentations are obvious on palpation. Equipment. Povidone iodine or antiseptic soap. 4x4 gauze or washcloth. Towels. Sheet. Gloves. Blanket. Procedure. The general procedure for delivery when infant is in the caudal position is as follows. Put on gloves. Position the patient supine with knees bent and outward. Drape with a sheet. Swab the perineum with povidone iodine or antiseptic soap. Continued. Drape the perineum with towels. Usually, the amniotic sac has broken. If not, break the sac with your finger. Note the color and consistency of the amniotic fluid. Gently stretch the vaginal opening by pushing outward with your fingers. This will help to widen the opening. Continued. Once the head emerges, suction the mouth and nose. Control the baby's head with the non-dominant hand. Check the neonate's neck for the umbilical cord. If it is wrapped around the neck, pull it gently over the head. If this is not possible, either it is too tight or has too many loops, double clamp the cord and divide the cord between the clamps. Continued. To assist delivery of the anterior shoulder, apply gentle traction toward the mother's posterior. If this is unsuccessful, try pressing down over the mother's bladder to move the anterior shoulder posteriorly. If this is unsuccessful, deliver the posterior shoulder, rotating the anterior shoulder posteriorly, and then deliver that shoulder. Continued. Once the shoulders are out, the rest of the baby slips out quickly. Keep the non-dominant hand in place, control the baby's head, and slide the dominant hand under and along the baby as it emerges. Once the feet are out, rotate the baby 180 degrees into a football hold. Suction the nose and mouth. Continued. Double clamp the cord 7 to 10 centimeters from the baby, and cut the cord between the clamps. If the child starts breathing and moving and appears to be in good health, turn the baby over to nursing personnel. If the birth is complicated by thick meconium, amniotic fluid that is thick and pea-green, do not stimulate the baby to cry. Use a 3.0 endotracheal tube, intubate the trachea, and suction it, then stimulate the baby's breathing. Continued. Do not unclamp the mother's side of the placenta until it is clear that only one fetus is present. Palpate the uterus. If it is almost in the pelvis, probably only one fetus exists. Let the cord drain, collecting a clot tube for laboratory studies. Feel gently for a pulse. After about 10 minutes, the cord will stop pulsing. Do not cut it before then. Continued. Allow the third stage of labor, delivery of the placenta, to proceed slowly. Do not pull on the cord. Guide the placenta out as it is expelled. Inspect the placenta to ensure that it is entirely expelled. Massage the woman's uterus just below the umbilicus until the uterus feels like a grapefruit low in the abdomen. Perform any vaginal or perineal repairs. Breech presentation. Have the mother sit at the edge of a bed and pull her legs to her chest. Place pillows or blankets where the baby is likely to fall. Do not touch the baby until the head is delivered, because your touch could stimulate the baby to gasp while the head is still submerged in amniotic fluid. The infant's back and bottom will hang down. Once the head is delivered, grab the baby under the arms and bring it up to the mother. If the head doesn't come out in the push after the arms come out, have the mother squat and push. Client instructions. Keep the mother and baby warm and comfortable. Cover them, both in blankets, when they're cold, and encourage the mother to keep the baby on her chest. Replace any wet or dirty bedding, and move them to a clean, dry area. Continued. Keep an ice pack on the vaginal area for the first 24 hours to ease soreness and pain. Take Tylenol or ibuprofen as needed. Pour warm water over the vaginal area every time you go to the bathroom to keep clean and prevent infection. Have a light meal, crackers and cheese, or peanut butter and jelly sandwich, and a drink.